Hey, folks. Today, we're going to talk about a surgeon that says, let kids slow down, won't you? We're going to talk about the shape of chiropractic in Europe, and we're going to talk about how exercise affects chronic pain. I hope you'll stick around, but first, here's that sweet, sweet bumper music. Okay, we made it back. Welcome to the podcast today. I am Dr. Jeff Williams. I am your host for the Chiropractic Forward podcast. I'm having a hard time talking today, but you have Jimmy jammed your way into episode number 72, and I honestly have no clue what a Jimmy Jam is, but I'm glad that you figured it out. We're here to advocate for chiropractic while we also make your life easier using research and some good, solid common sense and smart talk. Part of that, I think, is a little bit of patient education, right? Tools that educate based on solid, researched information. And we offer you that. We already did it. We're taking pre-orders right now on a brand new evidence-based office brochures at chiropracticforward.com. Just go and click on the store link. I'm telling you, colorful, professional, all based on research, which is cited on the back of the brochure. Very current, very cool. Go check them out. Sign up for our newsletter while you're there. It's just a damn email. I'm not going to spam you. Let's talk about the F4CP a little bit, huh? They're going to be launching, in case you didn't know what that is, F4CP means Foundation for Chiropractic Progress. Anyway, the F4CP, they're going to be launching an Athletes and Opioids eBook toward the end of this month, and it's called A Case for Chiropractic, Disrupting the Cycle of Pain, Prescriptions, and Addiction. Count me in. I'm going to link it in the show notes, so go there, go check it out, chiropracticforward.com, episode 72, the one you're listening to. Now, let's talk a little bit about the DACO program. DACO is Diplomat Academy of Chiropractic Orthopedics, and I am 5 hours from finishing all 300 hours, you people. Do you understand what I'm saying to you? The words that are coming out of my mouth into your ears, how awesome that is, that I'm only 5 hours away. I'm so excited. I've been taking a lot of amazing classes, and I don't even know where to start. So I'm not going to. I'm going to go. We listened to Dr. Anthony Nicholson for 2 weeks in a row, so I'm going to let that simmer for a minute, and we'll get back to the DACO soon enough, okay? Now, personal happenings here. If you hear something here that you really like, but you'd like it in a written form rather than spoken, then just hop on to chiropracticforward.com, go to the episode, and scroll down. You'll see the show notes. You can copy and paste it. If you use it somewhere, that's cool. Just give me credit. Or if you use some of the research we highlight, give those authors credit. They worked hard for that stuff, and know that they would appreciate it. Now, on to item number 1. This article is called Noted Surgeon Dr. James Andrews Wants Your Young Athlete to Stay Healthy by Playing Less. It was written by Dennis Manoloff of the Plain Dealer. Now, this was posted back in February of 2013, so it's a little bit older, but it's been making the rounds here lately in the private groups and with several of my colleagues. You see it popping up on Facebook here lately, 6 years later, but it doesn't matter because it's still relevant. It's right up our alley. When you consider we're also trying to keep kids out of surgery and off of drugs, right? Like opioids, painkillers, things like that. Now, some of the highlights. When Dr. Andrews says that they have worried for too long about patching people up rather than preventing the injury in the first place. Amen, brothers and sisters. Can I get a hallelujah? Oh, yeah, that's what I'm talking about. I love those sound effects. You know I do. You know I do. Now, the reason that is so awesome is because, preventative, right? You don't want to be cutting on these kids. You're going to see what they're talking about here. When asked why kids are getting hurt more and more these days, he says there are really two factors. One being that kids specialize too much now, and the other being what he calls professionalism. Now, what does he mean by specialization? Well, what he means is kids are just playing one sport these days instead of being well-rounded athletes involved in a wide array of different activities using a whole bunch of different skills. Basically, when they're only doing one thing and they're doing it over and over and over, well, you got a recipe for surgery due to overuse. Now, he says professionalism is taking these young kids that are 12 or 13 years old and working them like they're professional athletes with year-round training and activity. So you're not only you're training them hard, they specialize. Now, advice he would give parents that can help us guide our conversations with patients and parents was, number one, use proper mechanics in any sport. And number two, don't play year-round. The kiddo needs at least 2 months off each year to recover from a specific sport. Ideally, 3 to 4 months. You know, some of those parents, that's a tough sell, but 3 to 4 months off may just be what the doctor ordered. Basically, sometimes we have to look at mom and dad and say, hey, cut it out, or a surgeon will be cutting something out, right? I just made that up. But you can use it if you like it, because I like it. I think it's pretty clever. You don't even have to give me credit for it unless you are making money from it. And then, you know, shoot your brother a little moolah. All right. Item number 2, coming through before the DACO course. Chronic pain, while it should have been, was not necessarily on my radar at all as far as something I was interested in and something I wanted to learn to solve. It sure is now, though, and this next paper fits right in. It's called Exercise-Induced Hypoalgesia, a meta-analysis of exercise dosing for the treatment of chronic pain. It is by Ann Pulaski, Amy Phelps, Matthew Costed, and more. It was published in January 2019, and I've cited it in the show notes. Here's when they did it. As more and more studies are showing the effects of exercise as a first-line treatment for nearly all forms of chronic pain, things like dosing for different treatment modalities has not been explored just yet. And here's what they found. As you can deduce from the title, this was a meta-analysis, so this is pretty good stuff. And they say in the abstract, quote, increasing the frequency of exercise sessions per week is most likely to have a positive effect on chronic pain patients. To me, it's common sense, but it's good to have in writing. In the end, as is always a part of the conclusion, more research is needed, but there is a modest effect. Item number 3. This one was in BMC, Chiropractic and Manual Therapies, in April of 2019.
Hot stuff coming up.
All right, I want y'all to get ready for some mispronunciations because it was written by Haldor Gislason, Jari Salmonen, Lynn Sandhaugen, and a whole bunch of other names that I refuse to attempt at this time. But here's when they did it. Considering the ongoing split in the profession, the authors were looking to report on adherence to unorthodox descriptions of chiropractic and the types of chiropractic practice in Europe. Now, here's how they did it. They sent out an online survey amongst European chiropractors in 2017. They sent it out through social media and through the different membership associations. And what they found was they got back 1,322 responses, representing about 17.2% of the profession. The responses were boiled down, fitting into 2 different groups of practices. The 2 groups were categorized as orthodox and unorthodox. The orthodox group made up 80% of practitioners. I consider myself orthodox, so that's good to hear. The unorthodox group made up 20%. Now, here are some of the key differences in the 2 groups. 23% of the unorthodox chiropractors x-rayed over 50% of their new patients, while the orthodox chiropractors, they only x-rayed about 5% of their new patients. The amount of unorthodox chiropractors seeing over 150 visits per week was more than double the amount seen by the orthodox chiropractor. Then, of course, there's info demonstrating how unorthodox hates vaccines while orthodox chiros are fine with them. In wrapping up, they concluded by saying, quote, in parallel with other research, this survey suggests that key practice characteristics in contravention of national radiation guidelines or opposition to evidence-based public health policy are significantly more associated with non-orthodox chiropractic paradigms. Now, what does that mean exactly? Well, for those of us on the evidence-informed end of the spectrum, it means that we are in concert with 80% of the profession, at least in Canada and Europe, where these research type papers have been done. From what I recall, about 80% of the profession in America is either evidence-informed or somewhere in the middle, kind of agnostic. And it's not my place to argue if subluxation is a real thing or is not a real thing, because I believe people define it differently. So how can you say something's real when people can't even define the damn thing? But I can give you my opinion, and my opinion, which is not research because there is none to my knowledge, but my opinion is that if one defines a subluxation as something that can be removed, thus fixing cancer or infections and things like that, well, my opinion is that that definition puts you in the unorthodox category and puts you in that 20%, the minority, for sure. And that's my opinion, anyway, and that's worth diddly squat in the unorthodox community, so take it as you may, grain of salt, pebble on a beach, whatever. Now, we can also discuss the x-rays. I honestly have no problems with initial x-rays. I realize that flies in the face of a lot of newer guidelines, but I believe that we get gut feelings that don't fit into the definition of a red flag per se, and you damn well better get x-rays on those deals. I'd also say if you have a history of x-raying every single patient that comes through your doors, that's also putting you in the 20% these days, that 20% that is defined as unorthodox. And it's also meaning that you're probably by many considered an outlier. Outliers must keep an eye out. If you have contracts with insurance companies, if you're going to be an outlier, you'd best be a cash practice. Whether it be right or whether it be wrong in your opinion, insurance companies do not like outliers and unorthodox practitioners. And honestly, can you blame them? If I'm writing a bunch of checks and I have 80% of the profession over here mostly following guidelines, seeing people a reasonable amount of visits, I'm going to be cool with that 80%, wouldn't you? If I've got 20% of the guys and girls over here seeing people 100 plus times per year when the patient has absolutely zero pain and taking repeated x-rays on top of that throughout the year, well, if I'm writing those checks, I'm going to have a problem with that 20% at least 100% of the time, and you can believe it. So do whatever you're going to do, but you should at least give some consideration to what I'm saying. In the end, we're all getting people better, and the research shows it. So I'm going to just share the message that we share at the end of every episode. And that message is that with absolute certainty, when chiropractic is at its best, you can't beat the risk versus reward ratio, because spinal pain is primarily a movement-related pain and typically responds better to movement-related treatment rather than chemical treatment like pills and shots. And when compared to the traditional medical model, research and clinical experience show that many patients get good or excellent results through chiropractic for headaches, neck pain, back pain, joint pain, lots of other stuff. Now, chiropractic care is safe and cost-effective. It can decrease instances of surgery and disability. Chiropractors normally do this through conservative, non-surgical means with minimal time requirements or hassle on the part of the patient. And if the patient develops a preventative mindset going forward from initial recovery, Hey, chiropractors can usually keep it that way while raising the general overall level of health of the patient. But the key point is patients should have the guarantee of having the best treatment, offering the least harm, and folks, that's chiropractic. So send us an email at dr.williams@chiropractic4.com. Let us know what you think of the show. Tell us what your suggestions for future episodes are. Feedback and constructive criticism, you know what? It's a blessing. And so are subscribes and excellent reviews on iTunes and other podcast services, all that good stuff. You know how it works in 2019. If you like something, you got to support it, review it, and share it. We can't wait to connect with you again next week from the Chiropractic 4 podcast flight deck. This is Dr. Jeff Williams saying upward, onward, and forward. Be sure to find me on social media sites such as Facebook, Twitter, LinkedIn, and YouTube. While you're at it, give us a thumbs up on YouTube. That's super simple. Be sure and visit chiropractic4.com. Give our podcast a listen. Lots of wonderful, wonderful information there. And as always, thanks for listening. We'll see you next time.